The Director General of the World Health Organization condemning governments worldwide today, stressing the need for urgent escalation in testing.
You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
Let's bring in Dr. Oz now. Dr. Oz, thanks for being with us. Coronavirus has now killed more people outside of China than inside where the virus originated. What are the biggest obstacles right now to curbing the outbreak and flattening the curve, which we've been hearing so much about?
I think countries have to learn the lessons of Italy and Korea. It's a tale of two countries is pretty clear. South Korea took proactive steps early on. They have a healthcare system that could keep up with the flow of patients, and they've had a mortality rate that's 1/10 that of Italy. And the Chinese numbers have dropped dramatically, which is fantastic news. And it's also valuable for us to understand why they were able to do that. If you look inside of Wuhan province, they had a catastrophe. But outside the province, which of course they quarantined in the largest movement of its nature ever, 60 million people blocked in that space. But the rest of the country was relatively spared. They didn't have the big spikes, the huge crises that Wuhan experienced, and it took the country in a very different direction. We just have to copy what they did, take their blueprint and repeat it here in this country, and we started that aggressively over the last week.
So is it too late right now for the U.S. to adopt those policies? I mean, or has it been too late in maybe adopting the lockdowns, the curfews like we're seeing in New Jersey?
I don't think it's too late. I think we did it in the nick of time. It's probably a couple days of pain that we're going to go through where we really can't influence what happens this week in, for example, New York City, where I'm sitting now. The governor said he expects there to be 1,000 cases here. So last week we had, several dozen. But I think the week from now, we'll start to see the benefits of what many would call draconian actions, shutting down all public gatherings, limiting groups to initially 500, then 250. Now we're down to 50, which is probably the right size. And people have a newfound awareness of the seriousness of this. I mean, think about the handshake, right? This ritual that all of us grew up with. I haven't shook anyone's hand in the last 2 weeks. That's unheard of that we change that quickly. So it reinforces the can-do attitude of our public. But we're going to have, and I spoke to the Surgeon General this morning, 6 to 8 weeks of pain before we get through this. So even though we'll know in 2 weeks if we're on the right path, we'll probably have to continue some of these steps for a few more weeks until we can get past most of this. And then if we can get to let's say mid-May, without a major change, and we start to have improving treatments and more capacity and more testing so we can understand where this virus is going, then we'll be in a really good shape for the summer. And that's what normally happens anyway. The summertime is, with the humidity, the virus plumps up, doesn't travel as well, and we get a little bit of reprieve.
Well, we know Dr. Anthony Fauci said he'd rather be criticized for us overreacting than underreacting. Do you think that Americans will adapt well to these changes in society?
I think we'll adapt well. We already have. I'm seeing it in my own family. We had, ironically, keeping us apart, we're also bringing us together. All my kids came home. We had lots of discussions about the new normal. This is a generation-shaping event for the younger ones who are experiencing it. They've had to come of age with an existential threat that will probably return in their lifetime. For the rest of us, it's a dry run. But we're also taking more seriously things we should have focused on earlier. General public health issues. The weaknesses of the healthcare system are exposed in times like this. And thankfully, this virus, although it's very contagious, is not very aggressive. And yes, we'll lose some Americans. And the initial CDC modeling is a little scary. The idea of half the population infected and potentially 1 million deaths, those are crazy numbers. That stated, we're going to change that reality. But the next virus may not be so kind to us. So let's take proactive steps based on what we learned this time around.
And speaking of the healthcare system, what needs to be done to make sure that healthcare workers are protected and that the system isn't bogged down?
Well, people outside the healthcare system should not be wearing N95 masks. We need those desperately within the system. But the most important thing is to slow down the number of people who get so sick they have to go to the ER. If we do that, we won't have the crisis that Italy experienced, where doctors have to say, you get a ventilator, you get to die. And that's the ultimate way we'll keep mortalities down. The other thing to remember is we're getting pretty good at treating people who are sick, critically ill. America is already pretty experienced at that. We have medications we're experimenting with that work for Ebola and that have worked for the HIV that we're trying on this virus. There's some treatments for malaria that seem to be effective. And now we're also getting better treating the complications of the virus. So the blood clotting and the thromboses that we're seeing in patients with cardiovascular disease, we can treat that because that happens in other situations as well. So the longer we can stall the people getting sick who need the care the most, the better we can keep up with them.
Thanks so much for your time, Dr. Oz.
Take care.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.